Hello, my name is Sharad Mubarak, MD, and I'm here in Tamarack, Florida, in West Broward Internal Medicine. That's the name of the practice. I've been here for 27 years. What sets us apart now is that we're still that old-fashioned primary care doctor's office that's run by a single physician, that's owned by that single physician, and the buck stops with me. I'm aware, frankly, of everything that goes on in the office with pretty much every patient, and so I have control of everything, which unfortunately is not what's available out there anymore. Corporate medicine has at its core financial drive. I'm not sure when you try to translate that into healthcare that you're able to really do the right thing every time. I see 12 patients in a day, 6 in the morning and 6 in the afternoon. Each patient gets personalized care.
You know, a lot of doctors' offices, you could tell there's no care. They're not compassionate. They get you in and get you out. And here they didn't do that. They took time out with you. They get familiar with you as a patient so that they can offer you the best care possible.
My cell phone is on 24 hours a day, 7 days a week, 365 days a year. But it's really important to have that accessibility to the doctor. That really resolves a lot of problems quickly. The emphasis in this practice has always been for compassion and empathy. I think that our patients have stayed with us because they feel that when they walk in. So when a patient arrives in my office for the first time, I sit with them for an entire visit, usually 45 minutes to an hour, and review their medical records and try to find out what their real needs are. Now, because I'm an internist, I can address the majority of problems that my seniors have.
I found that an appointment was actually an appointment, and I've had that experience ever since. That if you make an appointment at 10 o'clock, they will see you at 10 o'clock, not like other medical offices.
Since I've been here over 25 years, I have made relationships with a number of specialists that at least I feel are top of their field. And for most of my specialists, I have their cell numbers. And since they know me for many years, we've sort of grown to develop a cohesive team that then can address problems even in very complicated cases. I have essentially the same staff for the past 15 to 20 years, very patient-oriented, very much in love with what we do. My wife helps run part of the practice, the finances. I have probably two of the most compassionate nurse practitioners I've ever seen in business. Patty has her own group of patients who she's followed for many years. Matthew has been with me with 9 years. He works directly with me on a daily basis. Alex, our office manager, she does all the referrals. So she knows, for example, which cardiologist my particular patient likes to see. We also turn the referrals around very quickly here because we have a direct connection to main insurance companies, Humana and CarePlus. So she'll do the referral, then call the office and actually make an appointment for the patient to be seen.
They know what my insurance will cover. So the providers that they send me to also work right along with them, which is very important.
I'm one of few of my peers that's a board-certified general internist, and I'm allowed to admit my own patients to the hospital. So I have admitting privileges at 3 different hospitals. The staff knows me, and when my patient arrives, they call me. If someone's sick and their own doctor arrives in the emergency room or at the hospital, it creates a sense of comfort to know that they know my face, they've seen me before, they know I know their history and their record, and that I also know all the specialists in that hospital, so I'm going to call somebody that I have history with, and the care goes much smoother.
Last year, unfortunately, I had to take my wife to the emergency room, and Dr. Mubarak showed up there the next morning. We had not called him. I don't know how he knew, but he visited her in the hospital, which I found amazing.
You need to pay attention to the patient's needs. Often they're medical needs, but they're mixed with social needs. And if we're not aware of what's going on at home, maybe unfortunately a loss of a spouse, sometimes a loss of a child, or a loss of a job, then you're not really caring for the patient. And when you do all that, you become close to your patients. And coming to work isn't about just treating high blood pressure, it's about managing the care of an individual. And that becomes very rewarding.